Hi, I'm Dr. Randy Martin, and I'm joined by Kathy Jenkins. Kathy is the co-chair of the college's Adult Congenital and Pediatric section, and they're really looking at quality metrics. So, Kathy, tell me, when I use the term quality metrics with congenital heart disease, what am I talking about?
Well, what we're talking about is really creating a scorecard that pediatric and congenital heart centers can use to understand their practice and how to improve their practice.
And that sounds super. But what's the term quality metric mean, and how do the groups improve their practice by these quality metric tools that you're going to have or instructions you're going to have?
Well, some of it begins just by defining what quality standards are within the practice of pediatric and congenital heart disease work. And because our field is really very new and it's been evolving very quickly, we just don't have the evidence base for a lot of what we do. And so there's a lot of variation in practice and variation in outcomes around the country. What we're trying to do through the ACPC section and this new initiative is to start to really define what these best practices are. And that's what this initiative is all about.
And which sounds super. And is it going to be also adult congenital, which is becoming a tremendous number of patients we're seeing now, so it's also adult congenital practices?
Absolutely, and the adult congenital practice is also evolving very quickly and pretty undefined right now. So the approach that we've taken is to really divide up the whole breadth of pediatric cardiac and adult congenital practice into different teams. And we have leads on each team who are trying to define what would be good quality measures and quality practices, and we're using the ACC umbrella to do that.
So, as an example, do you have a team that would be on transposition, or is it that specific?
We have a team that's on imaging.
Okay, so it's not disease based. It's really more like you're saying, imaging as it applies to adult and pediatric heart.
Absolutely.
Okay.
Yes.
And Kathy, how do you see that this is going to be shared, or how's this knowledge going to get out so that it'll change practices?
Well, we're really taking a lead on this through the ACC and through the section, and we've had a lot of support from the ACC. They've developed a beautiful web-based tool for us.
Okay, good.
It's like a chat room, but it also will be a place that people can go to learn about the initiatives, about the metrics, and about quality improvement more broadly. We also can take advantage of a lot of the prior work that's been done in measurement development from the adult world. We're also talking with the American Board of Pediatrics about how to incorporate what we're doing into the maintenance of certification requirements that are around the corner for all of us.
So you've got a lot of initiatives that are ongoing in that. So, Kathy, I compliment you and your section on doing this, because it's certainly, with the booming practice in adult and pediatric congenital heart disease, this will be a big help. So thank you very much for joining us.
Thank you.